A convex clinical response function has a structural asymmetry in how it reacts to dose fluctuations. Gains in patient benefit from a dose increase exceed losses from a dose decrease of equal size. This asymmetry is a property of the response function's curvature, not a property of any particular patient population. When patient outcome is a convex function of treatment dose variability translates into an asymmetric distribution of clinical outcomes. Upside captures more benefit than downside loses. This asymmetry is structural, not distributional. A concave organ response function reverses this clinical asymmetry. Losses from excessive demand exceed gains from reduced demand of equal size. Concavity penalizes physiological variability. Convexity benefits from it. Absorbing clinical states introduce a hard limit on realizing convex treatment benefits. Once an organ failure threshold is crossed, future outcomes are fixed regardless of the response function's shape. Convex clinical benefit without bounded downside risk can amplify harm as well as benefit. For a convex clinical response, the expected patient outcome under variable dosing exceeds the outcome from the average dose. This gap is a structural consequence of response function curvature, not of any particular patient distribution. The clinical benefit gap scales with dose variability. Greater variability in dosing or physiological demand implies a greater expected benefit gap under convexity. Convexity turns physiological variability into expected clinical benefit. Convex response functions describe clinical structure. They do not guarantee patient survival or positive outcomes. Convex benefit without bounded downside risk can amplify clinical losses. Curvature is a property of the response, not a treatment strategy.